Well, welcome everyone. I'm Tom Kearney, the Interim Dean of the UCSF School of Pharmacy, and I'm very happy to be joined by Dr. Yoona Kim, who's a 2009 alumni of the UCSF School of Pharmacy, currently a UCSF Alumni Association board member, and importantly, currently the founder and the CEO of a company called Arine. And just to give you a little bit of background, Arine is a medical intelligence platform with the mission to solve the significant problem of medication mismanagement across the healthcare continuum. This company uses innovative data science to develop programs to optimize therapy, reduce errors, and importantly, improve patient health and outcomes. And in this session of Under the Microscope, we're going to get Dr. Kim's thoughts on the future of data science and health patient care and the innovations that promote health equity. But first, I want to get a brief synopsis of her career trajectory and her education. So impressively, she has a bachelor's degree from Stanford. She received a PharmD degree from the UCSF School of Pharmacy, and as well as a PhD in health economics and outcomes from the University of Texas at Austin. And also, in sort of very impressively, her career trajectory has been, and it's a bright career, she implemented innovative healthcare design like value-based insurance programs while working at Mercer. She's also worked with two major pharmaceutical companies, Novartis and Gilead, in health economics, and was also head of clinical modeling and analytics at Proteus Digital Health. So sort of based on that, I'd like to begin our conversation, Yoona. In a bit more detail, could you walk us through your career and what brought you to create your own company, interestingly, and also important to me, and as the dean of the school, how did attending UCSF support that?
Well, thank you for having me, Dean Kearney. It's a pleasure to be here and share a little bit more about my story since UCSF. And no doubt UCSF has greatly contributed to where I am today. My career in healthcare actually began right before entering UCSF at Mercer Health and Benefits. I did a mix of actuarial and strategic consulting work for large self-insured employers. And as I was doing that and implementing different programs to help these employers keep their employees healthy, that's where I started to see the double-digit trend in pharmacy costs. And to some extent, we're able to keep medical costs in the single-digit trends, but pharmacy costs were exponentially rising. And that's what led me to be interested in attending pharmacy school and learning more about the clinical background of medications. And then at UCSF, I had the privilege of being part of the health policy and management pathway, where I learned about the field of health economics, as well as the money flow in the field of pharmacy. That led me to do a fellowship in health economics and outcomes research at UT Austin. It was a joint program between UT Austin, Scott and White Health Plan, and Novartis. So I got to see health economics and how to look at the value of different healthcare interventions from the perspective of a health plan, from the perspective of a pharmaceutical company, and then of course get the didactic training in health economics from UT. I ended up completing my PhD and then working in the pharmaceutical industry, where I was launching new drugs and helped build the health economic value story for these new blockbuster drugs at Novartis and Gilead. And then after a few years in the pharma industry, I really wanted to get on the technology side. As a health economics person in the pharma company environment, you're proving the value and you're sort of justifying the price of these drugs. And I wanted to be on the more scalable side of healthcare, on the technology side. And I saw all these new innovations coming to market. So that's when I joined Proteus, which is a medication adherence technology company. And what they did is that they had a ingestible sensor that you can combine with medications, and you can detect it was activated upon ingestion. So you can detect exact ingestion adherence. And then, as I was there, I started to see, that the problem was not just with medication adherence, but the problem was further upstream. Is this even the right medication to take in the first place? And that's really what led me to Arine. Arine is a combination of all my prior healthcare experiences. After 20 years of measuring the value of different healthcare interventions, I can say without a doubt that getting the medications right is one of the most important and largest levers that you can pull to control cost and quality of healthcare. There was a study published by Scripps that found that the cost of this problem of non-optimized medications was a $528 billion problem. And it's 100% preventable. So it unnecessarily leads to 33 million hospitalizations a year, leads to nearly 300,000 deaths annually. And again, it is preventable. So at Arine, we're really focused on solving this problem, combining data science and clinical expertise so we can solve it in a very scalable way through our medication intelligence platform, which will automatically detect in which patients' populations is a medication intervention needed and what that intervention should be to improve the lives of patients. And, UCSF both taught me the extent of this problem. When I was doing my clinical rotations, I saw it firsthand, patients being on the wrong medications and the issues that can cause, as well as UCSF taught me how to solve the problem from a clinical perspective. So it's definitely, and I do believe that the importance of pharmacy is increasing because people are beginning to realize that getting the medications right actually helps to control the medical side of the spend and decrease total cost of care. One other stat I'll share with you that I find truly fascinating, that the cost of non-optimized medications, this $528 billion, is basically the same cost that we spend on medications. We spend around $530 billion on medications.
That's impressive. No, thank you. This is just so impactful. And it's fascinating. I want to sort of carry this a little bit further. So, your thoughts on sort of the whole issue of use of tools of data science, like predictive analytics, and we hear terms like artificial intelligence and machine learning, and then how that sort of integrates with healthcare and elevates patient care eventually, right? I think is what your ultimate goal is. Can you give me sort of an example of sort of how that works within your company?
Yeah. So what our platform does is automate what we can automate that a clinician is doing manually today. So we pull in the data and we automate the patient targeting. And we analyze the data through our predictive analytics to identify who is at risk of things like a hospitalization or who's at risk of becoming non-adherent to their medication. So we use our predictive modeling for that. Then we automatically surface that in our platform for, usually it's the pharmacist clinicians who are logging into Arine's medication intelligence platform. And they're using this to guide then who do I outreach to? And then what are the interventions I need to make to prevent that hospitalization or to prevent that patient from continuing to be non-adherent to their medications. And then what we do through our platform is constantly measure the outcomes. So are we then seeing a decrease in hospitalizations because of the medication interventions that we made? And if we don't see an improvement in outcomes, then there's a constant feedback loop that goes back to hone who are we targeting and what are those interventions so we can always achieve improvements in clinical and economic outcomes.
Great. So what do you think, as we see, we have an aging population. I think talking to you before about some of your major clients that you have going in there, particularly folks like myself that are on Medicare. Where do you see this affecting the pharmaceutical industry and services such as yourself?
Yeah, so the baby boomer population is getting older. And I think by like 2034, the older adults will exceed the number of children for the first time. And there's an interesting publication that I was looking at the other day, and I think the title says it all. It says, how the drive to prescribe is harming older adults. And they're talking about how medication overload is happening in older adults. And there was a stat in this article that was saying older adults are hospitalized for adverse drug events at a greater rate than the general population is hospitalized for opioids. So imagine, again, the size of the problem, and specifically in the aging adult population. So anything that helps to adults manage their medications better. So this includes new therapies coming to market with less adverse events, even medication delivery services that help keep seniors healthy at home and they can get their services at home. Same with virtual care. I mean, I know we also have clinicians in-house, and our pharmacists are reaching out to older adults virtually and telephonically to be able to provide them with important medication counseling in the comfort of their own homes. And then also our technology is solving a huge problem in this population, just ensuring that it is, in fact, by looking at all the data that's available on this patient, by understanding the social, behavioral, and clinical context, we are getting the medications right and ensuring that they are the safest and most effective options.
So carrying that a little bit further as well, how can the scientific community in general create better access to quality healthcare and improving health equity and embracing this technology and data science?
Yeah, so the way that I look at this, and our CTO and I, we talk about this all the time. So clinical trials are based on very homogeneous certain subpopulations of patients. They're not based on broad patients. And then real world data always looks a little different, right, than the ideal clinical trial setting. So data science allows us to exploit all the available data and also all the features in that data to understand which healthcare interventions need to take place in order to improve the health of those specific individual patients who don't all look the same. And in terms of health equity at Arine, we are taking into account that data on race, ethnicity, language preference, social determinants of health, so that we can understand better the care that these specific populations need in order to improve their outcomes. I'll give you a very concrete example. We worked with Scan Health on a health equity program. The health plan saw lower medication adherence rates, and specifically the Black and Latinx population. So what we did is we pulled in Scan's data that they had available on race, ethnicity, language preference, combined that with other claims data and other sources to really, again, understand this population and who needs outreach. We fed it into our adherence trajectory modeling, which will proactively predict when a member is at risk of becoming non-adherent, after taking and takes into account other elements like what are the reasons for non-adherence, so that we can recommend a specific intervention that will close that gap. In addition to that, we matched, it was a linguistically and culturally matched program as well, where we matched our Black Latinx providers with their Black Latinx member population. And we were able to improve medication adherence significantly. So I think that data science really allows us to understand the needs in this population further and what we need to do to address the needs.
So I've got to ask this: how has COVID impacted both some of these, patterns that you've seen, as well as your own workforce?
Yeah, so actually, COVID has, in a way, COVID hasn't. People need healthcare anyways, regardless of what's going on with COVID, and the availability of chronic condition management needs to continue during COVID. So our services help quite a bit because people were afraid to go to the hospital or go to the doctor's office. They were afraid to leave their homes. But to give you a concrete example, again, we're working with a provider organization, Desert Oasis, and we allow their clinicians, through use of our platform, to transition to remote and virtual care very quickly. So instead of people coming into the provider offices, they use our platform to then target members who need outreach and also identify the right medication recommendations. And they were able to do this all virtually. So we helped with that transition. Also during COVID, there were unique needs around social determinants of health, like food insecurity and other aspects of care that, at the end of the day, like if somebody doesn't have access to food, they're not going to take their medications. And this is where our platform helped address that as well, where we actually gathered all the resources that our clients were offering to manage the pandemic. And we built in customized algorithms into our platform. So if we detected that a member had food insecurity, then a recommendation would automatically pop up that guides the members to how to access food resources. So those are some of the examples. Of course, navigating patients to medication delivery services, that was also key during COVID. But I think these types of solutions like we're providing are absolutely key to manage members effectively with their chronic conditions during COVID.
So, if somebody came to you, one of our students, and said, hey, I want to become a budding entrepreneur in healthcare, sort of follow your pathway, what advice would you give them on how to pursue that?
Oh, that's a good question. So a couple things, and I remember this coming from I watched a podcast once, and it was a very young entrepreneur. She was much younger than me, but much wiser. And she said, if you want to be an entrepreneur, you just have to take the jump. That's the hardest decision. And then from there, you'll figure it out. So two pieces of advice. One is, just take the jump. If you have an idea and you had the will to do it and a passion around it, then take the jump. And two, what I always tell my other co-founder is that, look, this company will survive as long as you and I keep going. It takes an extreme amount of grit and perseverance, but I have seen so many founders weather through the storms, pivot when they need to. If they want to make it work, they can make it work. So just take the jump and don't give up.
Gotcha. I have a couple other questions, kind of putting on my dean hat now.
Yeah.
So first off, what inspired you to move forward in a career in healthcare and pharmacy specifically? And we're trying to attract new students, new people to come into the profession. And actually what you have done is something that we were really seeking in terms of our pathway at the time. People that were going to, new vistas and, are going to be entrepreneurs and provide new opportunities for our graduates.
Right. Well, so I grew up with a mom that's a public health nurse. So healthcare is always in our dinner time speak. And I just thought that the work that she was doing was incredible in LA County. And I would volunteer at the clinic sometimes. I'd go with her on home visits. So that was probably the original inspiration. And then from there, it was just actually, from that Mercer consulting experience, what got me interested in pharmacy is seeing sort of how much drugs have an impact. The medication pharmacy component has an impact on just the total well-being of patients and the total cost of care of our healthcare system. And that's what inspired me to go to pharmacy school. And I think, like I said, pharmacists are being more and more elevated. I mean, our platform is really built for pharmacists, so pharmacists can work at the top of their license and do what they're trained to do, which is just really focus on the patient counseling piece and, reducing the anxiety that patients have around their medications.
So what, can you just expound on that? What specifically are the pharmacists in your organization doing?
So we have two models by which we work with clients. One is a SaaS-based model. So our clients' clinical teams, and there are a lot of pharmacists in our clients' teams that are logging into Arine's platform, or it's our own call center pharmacists logging into Arine's platform. And it also, the users of our platform include nurses, social workers, pharmacy technicians, but the main user really is pharmacists. And as they log into our platform, again, our platform will guide who needs outreach and then what those medication related recommendations should be. And so what our platform allows a pharmacist to do is just spend time on the actual counseling points instead of figuring out what's going on. And so our algorithms will look at, all the past diagnoses, what medications have been tried and failed in the past, what's the social and clinical behavioral context to really synthesize that information into very actionable medication recommendations.
Great, thank you. So just what is one of the favorite memories you had at UCSF in terms of an activity or something that you did with us?
Yeah, I have to say that probably my favorite memories are now with UCSF even. I mean, I get together with UCSF colleagues often here in the Bay Area, and then I'm part of the UCSF Alumni Board Association, and just kind of seeing where people have taken their careers and what they're doing today and how they're having an impact in healthcare today has really been great. Like that alumni bond that you have, and seeing like that network really come to fruition. So I would say that that's really the best memories are now and yet to come.
Thank you. I really appreciate this chat I've had with you, Yoona, and I am just so impressed with what you've done with your career and what you've launched beyond what we were able to provide some foundation through our curriculum. And I hope for the best for you and our public. And I think it's got a very prosperous future. So thank you.
Thank you so much for having me. It's very good to see you again.
Thanks, Yoona.